So this is a new admission. He's an 83-year-old man. He has a history of non-insulin dependent diabetes with an A1C of 6.3 on metformin only, and hypertension and asthma. So yesterday morning he was eating breakfast. He had the sudden onset of this substernal chest pressure. He was describing it as a lot of heaviness. Took himself to the urgent care clinic where they saw some sort of non-specific changes in his EKG and sent him to the emergency room, even though he clinically looked fairly well. So on his EKG, he initially had some changes in the inferior lateral leads, which sort of changed over time also. T-wave inversions became more marked. He was started on a heparin drip, and he was receiving nitroglycerin drip as well, but the pain was ongoing. So we brought him here for further management. The cath showed triple vessel disease, left main disease. He was recommended for cabbage, which will hopefully happen tomorrow.
Long-standing asthma?
Frankly, I didn't ask. I didn't ask when he was diagnosed.
The cardiogram shows long-standing asthma.
Yeah.
There's no voltage. And a guy like this at his age, and this very scant voltage, so you have to figure out why. I mean, it's unusual. But he makes, there's only 5 in the standard leads, and so maybe that's asthmatic, and maybe he's got emphysema. Do we have a chest x-ray? His diaphragms are really down. And there's air between the diaphragm and the heart on the left. But we can examine to see if he's got emphysema or asthma or wheezing or something.
Okay, so we go and see? Okay, what do we have here?
So she is a 67-year-old woman. History of very bad ischemic coronary disease. She has multivessel disease. She had a cabbage about 5 years ago. And she's had approximately 13 stents at various hospitals, mostly post-cabbage.
Excuse me, how many?
13.
Stents?
Yeah.
He is very efficient, the cath lab. You don't breathe, and this patient is already there. One of the problems in the culture is that you have things available and you use them, but you still don't have the right question of why you use them. If there's any message we can give to you, be sure you don't do something just because you have technology available. Technology is available, but your heads should be also available. Okay, so what do we have here?
So this is a new admission from Miss J in bed 5. So her chief complaint was that her ICD discharged. So her story, she's a 22-year-old female. She's from upstate New York. She's status post-AICD placement and LVAD placement in August. She's on the transplant list. Also has atrial fibrillation on Coumadin. So she was in her usual state of health since her last discharge from Mount Sinai, which was in September, after coming in for the LVAD placement. She'd been doing well for the last 3 months until about a week ago when her ICD fired. She went into the hospital in Buffalo. They basically interrogated it, didn't think that there was anything abnormal with it, repleted her electrolytes and sent her home. On Tuesday, she woke up, was just watching TV, started to feel a little bit weak, a little bit of palpitations, and at that point her ICD fired again. So she went to the emergency room, and in the emergency room in Buffalo, her ICD fired 2 more times. She was found to be in non-sustained monomorphic VTAC, and they started her on a lidocaine drip. At that point, she was transferred to us last night.
Hi.
Hi.
How are you?
Fine.
So we understand that you got this heart disease during your pregnancy or after your pregnancy?
Yeah, after.
Afterwards.
Yeah. Well, he was born in February, and I got diagnosed in May.
That was your first child?
No, second.
Second. Did you have this after your first child?
After the first one, I had some difficulties, but they couldn't figure out what it was, so.
What was the difficulty after the first birth?
Well, I was short of breath. I passed out a couple of times.
After
during
the first
activities.
So your activities were limited, you were short. So after the first child, she was already in trouble. And they didn't understand at the time what was the trouble was. Is that the idea?
And I had a regular heartbeat, but they didn't know what it was.
So you had an irregular heartbeat, you were short of breath all after the first child. And then you get a second pregnancy. And so the myocardiopathy was there the first time, and then the second pregnancy really does it.
Were you told after the first pregnancy of the dangers of a second pregnancy, or nobody knew?
No, they didn't know what was wrong.
I see. When you the cardiomyopathy in pregnancy, 75% continue to have left ventricular dysfunction. And the 25% that they recover, 50% they have a recurrence after the second pregnancy. But if you did not recover, the chances of getting worse are high on the second pregnancy.
And so now we're going to take care of you. Give you a new heart and make you feel better.
Yeah.
That's the plan.
Yeah, I bumped up on the list.
Yeah, you're 1A?
Yeah.
That's wonderful.
Can I see that just for a second? You know, one of the problems is I don't see the venous pressure here. And I will never leave seeing a patient without seeing the venous pressure. So how do you do it? I don't see it. It's too low, maybe. Diuretics?
No, you don't take any diuretics, do you? Right now? Oh, aldactone, yeah. That's fairly new. We had the medication list in front of us. He didn't. And he kind of knew she was getting these medications. That's pretty powerful, I think. That's what I remember, mostly because I was wrong. You tend to remember the things when you're way off. But that's what stuck with me, that he could pick out the presence of these medications simply by physical exam.